Hi there, I'm Bob Spool. I'm the Associate Clinical Educator for Meducate, and today I've been asked to perform or demonstrate blood pressure management.
Yes.
First of all, I'm going to wash my hands. I would, obviously while I'm doing this, I would speak to the patient and confirm their name and date of birth and possibly ask them how old they were, because this can sometimes have an impact. I'm then going to explain to the patient and ask a few questions about have they rushed in, have they been drinking caffeine, have they just had a smoke, because all of these things can affect their blood pressure. Once I've ascertained that they're in a relaxed state, I'm then able to do the blood pressure. I'll explain what this involves. I'll explain that the cuff will go tight around the upper arm. And it won't be painful. It might feel a little bit tight, a little bit uncomfortable, and if at any point it's too much, I'll stop and we can start again. I'll also want to check the size of the cuff as well. So I'll look at the length of the cuff to make sure that it's appropriate to the patient's arm. This one is. I'll also make sure that it's functioning, that it's on zero. I'll also check the valve to make sure that it's in a loose position and not, because these are often broken. The equipment, the stethoscope, which I'm going to use, again, all of this I'll be explaining to the patient. I'll make sure that the stethoscope goes in with the earbuds forward, and that when I listen through the stethoscope, I'm just putting it by the side of my ears for demonstration purposes, I'll check that the diaphragm's enabled and not the bell. That can be activated by turning the stethoscope like this. I'll also make sure that I've got a timepiece to measure the pulse, which I'd want to take in a moment. Once I've explained this to the patient in layman's terms, I'll then ask the patient to place their feet equidistant on the floor and to relax. And during the process, not to talk at all. So the actual procedure itself will involve, first of all, taking the patient's pulse. Now this can be done on the radial pulse or the brachial pulse. The brachial pulse is situated on the medial aspect of the bicep tendon. Either or can be done prior to taking the blood pressure per se. I'll take it with a stopwatch, placing my thumb, preferably finger, on the brachial pulse, and time it for 30 seconds, and times that by 2. And that'll give me their rate, their pulse, which is fine. Okay, they've got a good blood pressure, a good rate, good rhythm, good character. So, explanation. I'm going to place the stethoscope around my neck, so it's ready to use. I've checked the length of the cuff, and I'm now going to place the cuff on the patient's arm, in the upper arm. I'm just going to wrap this around, not too tight and not too loose, and making sure that the tubes here, the pipes here, are over the brachial artery. Make sure that's situated. Most blood pressure cuffs have got an arrow demonstrating where the brachial pulse is. And the first thing I've got to do now is determine the systolic blood pressure of the patient, which is the first reading that I do. In order to do that, I need to occlude the pulse. So what I'll do, before I use the stethoscope, I'll place my fingers. I usually use 3 fingers to make sure I've got the radial pulse. It's firm pressure, but not too hard to occlude the pulse. And I wait till I can feel the pulse now. Looking at the SFIG reading, at the moment it's on 0. I close the valve, not too tight because this can damage it, and then pump it up. I'll continue to pump the blood pressure cuff up until I can no longer feel the radial pulse, which is now gone. That's my systolic pressure reading, and I'm getting that at about 125. Okay, so I release the valve because I don't want the patient to be sitting with this on the arm too tight. And there's other reasons for doing it, which I won't go into, but that's what I need to do. So I've now determined the systolic blood pressure. That's the first reading. Okay, the base level systolic blood pressure. I'll put the stethoscope in. Again, double check the diaphragm. Place this under the cuff, over the brachial artery. Close the valve. And I'm now going to pump this up to 30 or 40 millimeter of mercury above the previous reading, which was 125. So I'll pump this up, and that's above the original reading by 30 to 40 millimeters. I then slowly release the valve. This is really important. When you slowly release it, I'm waiting for the first Korotkov sounds to appear. This means I have a true reading of the systolic blood pressure, which starts now. And again, it started about 120, 122. I'm now keeping the valve in this position, not opening any quicker. I notice the needle's going down. And as it's going down, the sounds start to decrease in volume. And I'm waiting for the fifth Korotkov sound, which is when the pulse finally stops, which is around 82. So I've now got the systolic and diastolic blood pressure of 122, 123 over 82. I'd say to the patient, I'd like to repeat that again several times, 3 times, and take a mean and an average of that. I take the cuff off the patient, like so. I thank the patient, ask them if there was any discomfort. It wasn't an unpleasant experience.
A 40-year-old adult with no comorbidities has a blood pressure reading of 150 over 90 millimetres of mercury. What steps would you advise?
Okay, so just to confirm that it was, because that's a high blood pressure, I'd like to repeat the blood pressure another couple of times just to make sure. I couldn't obviously advise any type of intervention, medical intervention with this. It is high. I'd speak to my senior about this, another health professional who could administer the correct medication. But certainly I would be able to offer, as a second year, I'd be able to offer lifestyle advice. So stopping smoking, drinking habits, diet and exercise, because all these things are important to somebody's health and well-being.